afternoon, everybody. My name is Chanikarn Chaksupa. Topic of my research is a comparison of implant stability between aggressive and non-aggressive dental implant design using two different stability measuring techniques in vitro study. My advisor is Dr. Atipan Kimkhao. First of all, as everybody knows that implant stability is a measurement of the intimacy between bones and implant, and it's also a useful predictor for osseointegration. They claim that if implant lack of stability or has a micromotion, it can disrupt the healing process, which lead to a fibro-osseous integration and implant failure. There are many factors that affect the primary implant stability, which are bone-related factor, surgical procedure, and the implant characteristic. First potential factor is implant characteristic, which is its micro design and macro design. Currently, new material has been developed, which is a hybrid of titanium and zirconia, and it provides a greater strength and biocompatibility. As a result, the risk of fracture is reduced, allowing the dentist to choose a smaller size of diameter implants, and in the case of limitation of anatomical. Moreover, most of the implant company offer the taper implants due to the advantage of lateral compression in poor bone implant site. And also the aggressive thread design was introduced. This implant design provides a special ability to cut the bone during insertion and obtain the better primary stability after implant placement. The difference between non-aggressive and aggressive design are that aggressive thread design has a deeper thread depth, so they have the ability to cut the bone during insertion, resulting in better primary stability. Move on to the second factor, which is bone quantity and quality. Various bone assessments have been proposed. They were commonly classified into 4 bone types, which is D1 to D4, based on compact bone to trabecular bone ratio. And recently, material which commonly used to mimic jaw bone for mechanical test in laboratory experiment is polyurethane foam block. And the last factor is a surgical technique. Lately, a new digital technology called static computer assist implant surgery, or CAIS, has been used to plan implant position and design a surgical guide stent before surgery. It had been stated that guided implant surgery has a higher precision and accuracy than a conventional surgical guide or freehand implant surgery. So now, how to measure the implant stability? To predict the outcome of implant, various techniques for evaluating implant stability have been developed. RFA is one of them. It is a non-invasive instrument that has an excellent repeatability and reliability. It was reported as an implant stability quotient, or ISQ, ranging from 1 to 100, which is the highest stability. However, in the process of ISQ measurement, the healing abutment must be unscrewed and the smart peg must be connected to the implant. As a result, the routine of unscrewing, healing abutment, and the peg back and forth may have an effect on implant stability and osseointegration during critical period. So Consequently, the implant stability test or IST device has been developed to detect the stiffness between alveolar bone and implant by slightly tapping at the healing abutment. The any check can also utilize without unscrewing the healing abutment. It strikes the healing abutment 6 times over during 3 seconds and convert into IST value. So this device provides a safety measure for detecting initial implant stability. But the research on the any check is limited and more study is needed. Also, the new aggressive thread implant that I just mentioned about, none of the study have assessed the primary stability of it using both ISQ and IST value. So the objective of this study is first to investigate the primary stability of aggressive thread design implant comparing to the non-aggressive thread design implant. And the second is to evaluate the correlation between ISQ value and IST value. For material and method, the implants that I used in this research is BLX for aggressive thread and BLT for non-aggressive thread. And for the measurement device, I use the Ostel ISQ and the AnyCheck for IST. For the model preparation, I create a U-shaped full arch model from an intraoral scan file. At both identical areas, a hollow space was designed to be the implant locations. 32 digital models were produced using 3D printer. The hollow area at each side was packed with 4 different kinds of the polyurethane blocks. And then each model were given number from 1 to 32 randomly, and all models were chosen to the procedure in order. Each implant were digitally planned and create a surgical guide on the software, which is the core diagnostic. The model were attached to the phantom head in the supine position in order to simulate the real procedure, and the surgical guide was placed on a model and evaluate the fitting before the implant placement procedure. 2 drilling systems were applied in this experiment. Same design of implant used the same protocol, and drilling procedure was carried out following manufacturer instruction. The BLX was placed at the upper left premolar area, while the BLT was placed at the upper right premolar area. For the stability measurement, after implants were placed, the standardized mark was hand screwed into the implant fixture, and the probe of the device was held close as much as possible to the peg and at the buccal and mesial direction. And another measurement is an AnyCheck, the IST device. This device needs to maintain the contact angle between 0 to 30 degrees downward based on the ground level. And the measurement was performed at buccal and lingual aspect of healing abutment. The ISQ and IST measurement were performed 3 times separately on each side. For statically analysis, I used the Chabirovic test, Spearman correlation test, and the Mann-Whitney test. For the result, the mean implant stability value and the standard deviation were shown in the table. And the implant stability between BLX and BLT was analyzed by Mann-Whitney test. And I found that, and I found statistically different between stability in both ISQ value and IST value. The correlation between the ISQ and IST value was found in both implant types. and the ISQ value tend to have a higher value than the IST in both implant design. For discussion, according to previous study, implant threads are used to optimize the initial contact, enhance stability, increase the surface area, and absorb interfacial stress. And it has been shown that macro thread design has an effect on implant stability. And so the knife edge design has an overall higher mean ISQ value compared to the standard one. And moreover, the previous study reported the highest of ISQ value in noble active, which is the aggressive thread design, and it can create the extensive groove in apical part, while the groove from other implant was much smaller. The results show that there was a significant correlation between ISQ and IST value in both BLX group and BLT group. Moreover, there is a study that reported a similar result. The IST value were strongly correlated with the ISQ, suggesting that the IST value follow the tendency of the ISQ value. So these two devices seem to be comparable. And as we know currently, the Osteo ISQ device has been increasingly performed in the clinic. But while using the Osteo ISQ, the healing abutment must be removed and the smart peg must be connected, which may create a difficulty and limitations. So since the any check does not require unscrewing the healing abutment, the procedure is less difficult than the Osteo ISQ, and also the measurement of the any check device were consistent with the ISQ value. The value ranged from 1 to 99. And moreover, the tapping motion was optimized by using shorter tapping interval and apply less force to the implant, resulting in more secure technique. And in addition, the computer assist implant, or CAIS, were utilized in this study for controlling the position of implant in every model and guaranteeing that all implant would be placed in the block. And the CAIS show a significantly less deviation than the freehand surgery in all parameters. However, sometimes they require relining with the acrylic lacing before surgery. So in this study, the surgical guide was individually created to confirm fitting in advance of the procedure in order to eliminate the instability of the guide. The limitation of this study was this research design did not allow for comparisons of the device in osteo-integrated implants, and more in vivo studies are necessary before the device may be used in clinical setting. And the correlation between the device may reflect the tendency toward the implant stability, but it cannot provide precise number indicating implant prognosis. For the conclusion, the aggressive thread design implant showed the superior stability than the non-aggressive thread design implant in both ISQ value and IST value. And within the limitation of this study, there was a correlation between ISQ and IST value, which is the ISQ was higher than the IST in both implant design. Okay. thank you for your attention, and thank you so much for having me today in this meeting.
Thank you, Dr. Chanikarn. Thank you very much for your informative presentation. Is there anyone have any question? So, Dr. Chanikarn, could you please explain more about your block model that made of polyurethane, right? Okay. If compared to the hardness of bone type, do you have any information that this block model, when compare the hardness to the bone type 1, 2, 3, 4, which level of this model block?
In this study, I used four types of the four bone type of the block to like mimic the variety of the bone in human bone, like mixed bone.
Mixed bone.
I
Okay.
use it. Yeah.
So that means you have various. Sorry.
Yeah, I in this study I use four types of the bone block in the space.
So so the hardness of the polyurethane, you can use the different composition to make it the various level of the hardness, right?
In this study, in the hollow area is what packed with four different kinds of the block. In this study, we random the bone type in the space, in one space.
And when you analyze the information, so do you have the information about the different level of the bone type and the ISQ? Do you have any information about this?
No.
Because you have different type D1, D2, D3, and D4, and when you show the result, did you have any information about the ISQ or IST for this different type of the bone?
I mean, in this study, one hollow space, space, there are four bone types in one hollow space, but we random stack up and random it.
Okay. Or you mean in one there are different types? Okay, I got it. Okay, thank you. Okay. So because BLX from the company, they recommend to use in the bone type 4, right, to increase the stability. So that I thought that you use the bone type 4 mimic for this study. But you said that you in one hole, that is for all D1 to D4, the hardness that is all in one.
I want to like mimic the cortical bone also as the human bone.
Okay, I see. Okay.
In this study, we use four types of the material.
Okay. And I have the question about the BLX. is the diameter include the thread, because the thread of BLX that is bigger than the BLT. In total, the diameter of BLX is wider than BLT. I mean that the BLX, the total diameter that is bigger than BLT.
From the company, actually, they are slightly different between two types of implant already. It's not